With numbers on the rise across the nation, many people are anxiously waiting to be vaccinated. People living and working at long-term care facilities in Virginia just started receiving the shot this week. Our Cameron Thompson joins us live to tell us how the facilities are handling the vaccinations right now. Cam?
Yeah, and Bill and Candace, we're outside the Westport Rehabilitation and Nursing Center here in Henrico County, where one of those vaccination events will be taking place tomorrow with, among others, Governor Ralph Northam in attendance. And it and others are being handled through a partnership between the federal government and two pharmacy chains. While testing for COVID-19 continues across the Commonwealth, vaccination efforts took a step forward this week as the vaccine began arriving in long-term care and assisted living facilities. Keith Hare's association represents 94% of nursing homes and about 100 assisted living facilities in the Commonwealth.
They are just feeling a lot of hope right now, which is just a wonderful thing to hear because they've been through so much over the last 9 months.
Under Virginia's vaccination plan, those locations are a part of what's known as Phase 1A. Approximately 500,000 people, healthcare workers, make up the other portion and have been given access over the first 2 weeks of the rollout. As of Tuesday, over 47,000 first-round doses have been administered. But starting Monday, teams from pharmacies, CVS, and Walgreens, seen here administering them in other states, began visiting long-term care facilities. Hare says how it's been done has been dependent on each site.
In some cases, we know that they've gone door to door, and in other cases, they've actually used open spaces within the facility.
Pharmacies say there are over 870 such facilities around the state, and much like those who dealt directly with COVID-19 being at the front of the healthcare worker line, Hare says nursing homes will be ahead of assisted living facilities.
The nursing homes are at the greatest risk of having spread, and also the vulnerability of the residents within the nursing home is greater than those in assisted living.
Hare says teams will make 3 visits to each site to ensure everyone gets the necessary 2 doses of the vaccine. He says he hopes the majority of the work will be done by mid-March and might allow for somewhat of a return to normalcy.
What we're hoping is that if the vaccine effectiveness is what we believe it is, then, we're very close to, family members, being able to see their loved ones on a more regular basis.
But Hare warns, as so many others have, that until the entire general population has access to the vaccine, which would be sometime in the summer here in Virginia, people will continue to need to take precautions such as mask wearing, hand washing, and social distancing. Working for you in Henrico County, Cameron Thompson, CBS 6 News.